Hi class, welcome to week 5. In module 3, we will continue our learning around vulnerable populations and global health, but with a focus on health disparities and social justice, and the common health challenges faced by vulnerable populations. When I think about health disparities, I think about the basic right for every human being to have access to care that is high in quality, that is safe, and regardless of what their race, gender, socioeconomic status is, culture, they deserve the right to quality health care. I also think about social justice as a challenge to challenge the actions of an unjust society and creating efforts to reduce healthcare inequalities. We know that our patient populations are growing. The evolution of healthcare is that, the baby boomers are retiring, that our patient populations are getting older, sicker, and have more, complex chronic conditions that are more complex to manage. So we as healthcare providers and healthcare organizations are charged with implementing processes that are innovative, that we can meet the needs and demands of this growing populations and promote quality healthcare outcomes. In looking at health promotion from a vulnerable populations and global health perspective, we know that some of the top priorities worked on globally are around the promotion of health and well-being for mothers, infants, and children, more smoking cessation programs, getting a handle on cardiovascular diseases, controlling infectious diseases, reducing the incidence of TB and malaria, HIV/AIDS, and also we have an increasing need for mental health resources and helping our patients who are challenged with obtaining resources for mental health care. And these are just a few things that we're looking at from a global perspective. Also, we know that global health, it looks at or studies the population and the risk factors for these populations and what environmental factors such as, what type of exposures the communities are around them, and the evaluation of outcomes and statistical data such as morbidity and mortality rates, infectious disease, the number of people with disabilities or causes of disabilities, and the population growth. I want you to look at this week in Module 3, read the information available to you around, factors that relate to the global burden of disease. But I also implore you to read the information regarding healthcare inequality, what is the common cause of death and disabilities, learning about what type of health prevention program and resources are in place now, and also what type of health disparities affects the aging older adult population. For week 5 discussion board, you will talk about your health promotion projects and what have you done so far. Post your ideas and what work you've done, and respond to your peers and promote conversations that will have all of you engaged and think a little bit more critically around your health promotion projects, around the population that you will be serving. I can recall that, I was charged with doing a health promotion around diabetes education, and my area was around complications of the disease. And the population that I was serving was a population of lower economic status, challenges with health literacy, understanding their condition in itself. So the things that I had to think about when creating my education and my teaching material, I used a lot of visual aids. I thought about what was the appropriate reading level for this population, and I wanted to keep the information basic, so I used a lot of bullet points as well. And when I did the presentation and I taught the information, I tried to be a part of the group and teach it at a basic level, not just throwing out a lot of high-level clinical words or terminology, but try to take the information that I had and put it into real world situations for them in their community. Just a little reminder that your health promotion projects are due on Valentine's Day, which is Sunday. And if you are experiencing any challenges or have any additional questions or concerns around your project, please feel free to email me or post a question on the Ask the Faculty, and I will get back to you on that. And also just a reminder to please review your course calendar for all assignment due dates. Thank you, and hope you all have a great week.